Hi everyone. My name is Ishmael. I work at IFSA, Islamic Family Social Services, as an outreach worker. I'm here today with two lovely people from the Edmonton area midwives. If you'd like to introduce yourself, the floor is open.
Hi, my name is Marie Tutt, and I'm a registered midwife from the Edmonton area. And I've been practicing for about 30 years. Over the last couple of years, I've also been involved in a project that's been supported through Alberta Health Services to help expand midwifery services into marginalized, underserved, and Indigenous communities. The goal of this has been to network with local organizations who offer supports and resources to pregnant people to help increase the awarenesses of the services that we offer as midwives.
Hi, I am Layla Ahmed, and I'm a registered midwife working in Edmonton as well at the Edmonton Midwifery Cooperative. And I've been practicing midwifery for the last about 12 years. Yeah.
Okay, nice to meet both of you. So what exactly is midwifery? How did that all get started?
So I'll just give a little bit of a background. In Alberta here, we've been regulated by the provincial government since 1998, which means that our practice and our scope of practice is determined and followed through the Alberta government and regulated through the College of Midwives of Alberta. In addition, all midwives now go through a 4-year degree program with extensive training in prenatal, labor, birth, and postpartum care of the mom and her baby.
Okay. So how exactly is a midwife different from, let's say, an OBGYN or a doula?
So midwives and obstetricians are both primary care providers that provide clinical care. They are different in a few areas. So OBGYNs are doctors, they are surgeons as well, and they provide both low and high risk obstetrical care. Midwives specialize in low risk obstetrics, and we look after clients through pregnancy, birth, and postpartum for the last 6 weeks, and OBs typically look after just the client, not the baby, whereas we look after both. We also follow a philosophy of care that has 4 tenets. So client-centered care, continuity, informed choice, which is basically that we go through all the standards of care, recommendations, community standards, so that our clients are aware of why they're doing things and have the choice to opt in or out. The other piece of midwifery is choice of birthplace, if I haven't mentioned that already. So we provide care both in the hospital and out of hospital at the birth center and home. And our job is to advocate and support our clients in making those decisions about where they'd like to birth. We are the same in providing supportive care that doulas provide as well. However, we are clinical care providers, whereas doulas are not, and we go to university to become a midwife. Doulas are currently not regulated. However, there is doula training.
Okay, that's very
I don't want to
interesting.
offend any doulas in the process.
Yes, for sure. Okay, so who exactly is eligible for these kind of services, and is it actually covered by healthcare?
Yeah, so it is covered. Sorry, go ahead, Marie.
No, you go ahead.
No, I was just going to say that if you have Alberta Health, it is covered. So you're not paying out of care for the midwifery.
Yeah, so and every pregnant person in Alberta is actually eligible to apply for midwifery care. So typically the process is that you would apply through the Alberta Association of Midwives Client Care Intake. And once your application is accepted within the system, then midwives actually go through that intake process and will reach out to clients from that end. Or perhaps the intake process through the co-op might be a little bit differently because you could contact them directly.
Okay. So once a client kind of goes through that intake process and they do get set up with their midwife, what kind of resources are the midwives actually able to connect the people with?
Oh, it's pretty individualized. We're really assessing, each appointment, what the needs are. So that can be ranging from social supports, counseling services. We, at our specific practice, have a community closet, which has clothing and supplies as well. So really, it really depends on what the needs are. And part of the goal of this is to increase awareness because there are many ways that we can collaborate and provide better wraparound care.
Okay. And what about the midwives themselves? What kind of services are they providing to their clients?
So a lot of what we do is, I think it's fairly broad. We do all of the clinical assessments. So for instance, we, will monitor the mother's well-being and the growing baby's well-being. We also provide the emotional supports for her during that, if that's something that she's needing, and also collaborate with other healthcare professionals should there be an indication that she would benefit from additional supports within the community. And that follows her through to the labor and the birth. And in addition, of course, there's always a lot of things that can come up during the postpartum period. We offer a lot of breastfeeding and in-home support during that time as she's adjusting to dealing with a newborn and perhaps other family members as well. And we follow her and her baby through till 6 weeks. And then often at that time, in terms of our discharge planning, assist with getting them set up with perhaps a referral to a pediatrician or to a family doctor if that's something that they're needing.
Okay, wow. Those are some amazing services that you guys offer. So now these services, are they available in different languages as well?
There are a few midwives that speak different languages, and if those midwives are not available, then we work with the Alberta Health Services translation phone line, so we can provide translation services. That's unique to our practice, but I believe that midwives throughout Alberta have access to that service as well.
Okay. And so how do midwives and social workers actually work together?
Do you want me to go ahead?
Yeah.
So again, it really is case by case. I think, communicating the needs of the client and filling the gaps. So, the strengths of social work obviously is different than midwifery. There are some overlaps, however, basically collaborating to make sure that clients have access to food, shelter, emotional supports as needed, whereas midwife is responsible for the clinical care. And as we know, it's all connected, and having a team that is communicating and collaborating so that things aren't missed, and so that the client can have cohesive care is really important. And so there's lots of different ways that midwives and social workers can work together.
Okay. So how can social workers or other service providers actually register their clients to receive midwifery care? How is that done?
So the primary access point is actually through the Alberta Association of Midwives website. And when people go there, they'll see immediately that there's a client intake process. And once they go in, they put their name in, their date of birth, and some other demographic information like where they live and so on, their Alberta healthcare number, their contact information, emails, and so on. They can also put in a little bit about their history, if they've had another baby before, or even specifically what it is that they're looking for. Once that application is completed, that goes on to an Alberta site, and all of the midwives in, let's say, the Edmonton area can view that referral or intake, and from there, a midwife can reach out at that point. Or perhaps they can contact, Layla, you might be able to speak specifically to the co-op.
Yeah, so we actually have an intake form because we know that there are clients that are unable to access the Alberta Midwifery site. So there is a referral form that we have made up that you can fill out and fax over to our practice, and then our one of the midwives or the intake coordinator will reach out to arrange care. A piece that's unique to our practice is most midwifery practices typically will look after a client from pregnancy, starting in pregnancy. However, we have the capability of looking after clients even if they've already had their baby in the first 2 months, if they're requiring home visits, breastfeeding support, that kind of thing. So, and our intake, our referral form does have options to select that. So it is clearly laid out.
Okay, that's amazing. Thank you so much for all the information you shared. This information is also available on the Alberta Association of Midwives if you'd like to go take a look there as well. Thank you again for your time. I enjoyed speaking with you and learning a bit more about the Edmonton area midwives.
Thank you for having us.
Thank you. Thank you so much for having us.
Yes, no worries. Have a good day.
Bye.